and the importance of early detection and prevention of gynecological conditions. This day aims to educate women and the broader community about gynecological health issues, including menstrual health, reproductive health, and common gynecological cancers such as cervical, ovarian, and uterine cancers. Today also seeks to dispel myths, reduce stigma, and encourage open conversations around gynecological health to ensure women receive the necessary care and support. And who better to have us join us, about this topic than Dr. Razina Patel, who's joining us all the way from her practice in Santon. Assalamu alaikum, Doctor. Welcome back to Urban Women.
Walaikum salam wa rahmatullahi wa barakatuh. Jazakallah for having me. It's an honor to be here. Inshallah, maybe impart knowledge and help the Ummah to take care of themselves. Alhamdulillah.
Ameen. Well, before we jump into it, Durban is a bit cold this side. How's the weather in Johannesburg?
Also cold and windy, and we're all back into jerseys and blankets.
So let's enjoy it before the warmer days start. Now, jumping into the topic for today, what would you say are some of the most common gynecological conditions that women should be aware of?
It's a can of worms we've opened up. There's a lot to talk about for the younger, the older woman. Some things that I'm passionate about, though, are women and vaginal discharges, because people are often wanting to be dry because of the Islamic rulings. If I may go on, shall I carry on with that topic, please?
Please do. I think many women are listening.
Okay, so the lining of the vagina is like the lining of your eyes and nose and mouth, because it's what we call a mucous membrane. And for all intents and purposes, it's meant to secrete fluids and be moist. So if we have a vaginal discharge, it doesn't necessarily mean that we have a problem, because the lining of the vagina is influenced to produce this mucus by your hormones and changes during your cycle, depending on whether you are close to ovulation or not. So there are a few vaginal discharges that indicate that you have an infection, and often whether it's itchy or very odored or a deep yellow color or sometimes even green or very watery, those are the ones that call an indication of infection. Actually, the white and lumpy one also. So creamy white vaginal discharge is not going to make you napak and is not going to break your wuzu. So we should just clarify that with our alima. And also that if you have an odored discharge or a thick lumpy discharge or a off-colored discharge, let us know. Let's see whether we can treat that for you. But every discharge is not an infection. And even when you do have the infection, most likely it is related to body balance rather than it is to partner or to hygiene. So don't jump to conclusions. See your doctor and get a good answer and treat it well.
That's so wonderful that you actually addressed that and you brought it, to our knowledge, because many women do experience that problem and think that every time I need to go and make wudu. But as you've explained now.
So can I quickly also add that your normal discharge does not break your wudu and it doesn't make you napak, but your normal discharge, if the stain on your undies is more than a cupped palm, so I guess a 2 rand coin size, then it's makruh to read salah with that undies. And I've asked about it, and Allah accept from me my efforts, and people can correct me if they are learned and I'm wrong. But I've asked many people. So that stain on your undies will make it makruh, so you just need to change it. I don't like the practice of using panty liners. Many of us teach our daughters even to use panty liners. And the truth about wearing panty liners is all you're doing is saving your undies, because what happens is that the cotton gusset can get quite worn out if you don't wear cotton undies, if you don't wear a panty liner, because of the acidity of the vaginal secretions. But the panty liner is not a good thing to use, because then you're using it 24 hours a day, even when you're sleeping. So that area of you doesn't get a chance to breathe. And I see eczema, a dermatitis, and itchy skin, a dry, scaly skin, because you've been wearing it for 10 years, 40 years, and not taking it out any time of day or night. So you shouldn't wear panty liners, plain cotton undies. The stain on your undies has those rules about it. And then you toss your undies when the gusset is worn away, and that's the best way to treat your vagina.
Thank you so much for that. How can regular gynecological checkups actually help in early detection of serious health issues?
So, for instance, let's go on to things like pap smears, right? So pap smears are meant to check for cancer of the mouth of the womb, so cancer of the cervix. They're not inherited. Cancer of the cervix is not inherited. It's not something you eat or drink. It's actually sexual activity. The earlier you start, the more partners you are, the more you have, the more at risk you are. Alhamdulillah, our dean teaches us how to be responsible about sexual health. So really speaking, in essence, we're not a high risk population. I stand to be corrected. The younger generation are different, but in general, we're saying it is not in our culture, and it is forbidden by our dean to have multiple partners and start early. But those are the people who are at risk. But we still do pap smears on everyone when they come to see us, because we're looking for cancer of the cervix. And even that cancer of the cervix is a pre-cancer, it's not actually a invasive cancer. So it's not that we are going to find you when it's too late. It's a surveillance mechanism. It's meant to sift people out from those who have early changes compared to those who don't have no changes at all. In addition to the pap smear, so people hate it and they think it's a really bad thing. Alhamdulillah, it's very doable. It's not very expensive. It doesn't involve you going under an anesthetic. A lot of treatments require you, or a lot of diagnoses require big, expensive investigations. So it gives us a lot of information. It's done on the bed. It's somewhat uncomfortable and awkward just because of the way it's done. But if you and your doctor have a good understanding, the doctor is gentle and informative, and you are relaxed, inshallah, it makes for a reasonable experience. I always say to my patients, I won't make you look forward to it. I'll make you not mind coming for one. So inshallah, we hope that we treat you well enough that you don't hate it, but don't listen to friends and don't read and don't Google how it's done and all of that. Just come and let's do it for you. In addition to checking pap smears, we also do now what we call the HPV vaccine. And the HPV vaccine, human papilloma virus. It's not HIV, it's not that sickness, it's human papilloma virus. And human papilloma virus is a wart virus. And there are two types. One is genital, which means it affects you down below. And the other one is general, which means that it affects you on your skin, your toes, your under your foot, all of those kind of things, but all of those kind of places. But the genital one is the one we're worried about. So the genital one is divided into a high risk type and a low risk type. And the low risk type gives you warts around your labia, your skin at the bottom, believe it or not. It often happens with people who are immunocompromised, when maybe they have HIV as well, maybe they are on chemotherapy, maybe they have some immunosuppressive condition, but we do see it. And then the high risk one goes into the vagina and affects the cervix and causes the pap smear abnormalities, which eventually will lead to a invasive cancer if not treated. So we need to see you to do pap smears. And in our private setting in South Africa, we do them every year, because what we've got into the habit, and if people are sitting around a table and talking about their gynae checkups, and you say, my gynae does one every 5 years, it'll look like the gynae is doing something wrong, because we've gotten into such a habit of doing it yearly. But in places like the UK, for instance, where they have a national health system, they do it once every 3 years. And it's a slow growing cancer, so you will see the changes. So you don't have to do it every year, but it's just become a luxury that we have. Yeah. So sorry. Then the other cancer to worry about is ovarian and breast cancer. And those are usually diseases of age. It doesn't mean that you don't get them when you're younger. If you have a family history, you've got to be really careful. Let's talk about cancer of the breast. It's unusual in young people. It's not that it can't happen. It's not usually painful, so it doesn't call you to it. You need to go looking for it. That means self-examination is an important thing to learn how to do. Oftentimes people say, I don't examine, I don't know how, I make lumps in my hands, I make myself scared. People even go so far as to say, the more I look, the more I'll find. And we're saying we don't make diseases, we make diagnoses. So from that point of view, best you look and we look as well. So I teach all my young people, or even the older ladies, how to examine breast, because once you're used to what the breast feels like, you won't be uncomfortable to examine regularly. So self-examination is important. Get somebody to teach you how to do it. And then besides self-examination, even if I'm the most experienced or more experienced than the patient, even I can't feel something smaller than a marble. Maybe a big peanut. Maybe I'll feel something like the size of a big peanut, but I'm never going to feel something the size of a pinhead. And cancer starts the size of a pinhead. So we need to find it when it is that little, because that's when we can cure it. So then the at-risk population, which are the people above 40. People above 40 have a high risk of getting breast cancer, whether you have a family history or not. The other day, somebody said to me, but I've got such small boobs. Is it possible in small boobs? Of course, it's possible in small boobs. It's even possible in men. But actually, men have breast tissue. They are made with breast tissue. So it can also happen in men. So from 40 onwards then, so younger people must self-examine. If they're unsure, let somebody professional examine for you. If you're unsure still, because you get something called a fibroadenoma, that is just areas of the breast that respond to the hormones a little excessively. So I say the breast is made up of like bunches of grapes. And all those bunches of grapes sometimes overreact to the hormones, and you'll get a little bunching up of the grapes in some area. But that one is going to be painful, and cancer is not painful, number one. Number two, is going to flare up as you're heading into a period, because the body thinks this is not going to be a period, this is going to be a pregnancy, and I've got a baby to feed. So if a lump comes up at certain times of the month and then becomes less obvious later, and if it's painful, it's not a cancer. But please have it checked as well. Of course, it must subside after that. The other thing about cancer is going to grow and grow and grow. It's not going to be obvious and less obvious and obvious and less obvious like that. So fibroadenomas are part of what young people will feel. But as you pass 40, you're looking for a cancer, because the risk of getting a cancer of the breast without a family history, with nothing else that's worrying in your family, is the lifetime risk is 1 in 26. So if you're 42, for instance, you take 26 42-year-olds in a room, and one of you in that room in your lifetime is going to get cancer of the breast. That's a statistic. Allah knows best, but the knowledge is given us is for us to use. So we're saying to those people, your hands won't feel it, my hands won't feel it, let's find a better way. And the better way is something called a mammogram. So we do a mammogram, which is a special X-ray. It's not as bad as people think. They do have to squash your boobs a little bit, because we're trying to get the X-rays to see through the breast. So we take it's kind of a plate attached to a machine, and you put the breast tissue on it, and then you flatten it, almost like you are flattening dough, I guess. And people say, but doesn't the mammogram cause cancer? And we're saying you're already in a group of people that is heading for cancer, 1 in 26. So in that room of 26 people, people don't talk about the person who got cancer and she never had mammograms. People don't talk about the person who is on HRT but never got cancer. People talk about the person who was doing mammograms and then got found to have a cancer, but she was the one we were looking for in the first place. A mammogram didn't give her cancer. She was the one we were looking for, and she's the one we found. So subhanAllah, we can take care of her with the grace of Allah and mercy and as his instrument. So we're saying that the mammogram radiation that you get is less than climbing onto a plane. So from that point of view, we talk too much amongst ourselves. We're scared of the cancer. We make up the stories, and the what you call it, the narration keeps going and going like that. So then we're talking about cancer of the ovary. Cancer of the ovary is also a disease of women when they are older. We should be scanning you when you finish your babies. It doesn't mean you don't need us anymore. We want to keep seeing you yearly, please. Mammograms must be done yearly, even if your medical aid says every 2 yearly. Can you imagine how much money they're saving by cutting their mammogram bill in half? But we don't want to miss anything. Even when you do your mammograms yearly, in that year, you can still get a cancer, Allah forbid, because we don't know which one is the person who's going to get it. So cancer of the ovary is the same. You must come and see us. I'm speaking fast because I know I don't have a lot of time. The cancer of the ovary is also a disease of older people. And cancer of the ovary is a small organ. It goes to sleep when you're in the menopause, but that's the time when it's the most dangerous. If you think about the abdomen as being a room, all the different pieces of furniture are the organs, and the dustbin in the corner is the ovary, which means that it's small. And when it starts talking that it's getting angry, it doesn't tell you it's angry until it's big enough to touch the organ next to it. And that's when it's too big. So we usually diagnose cancer of the ovary in stage 4, which is an incurable situation. And Allah reveals as he wants to reveal. So if he's kept it hidden until then, it's meant to be hidden until then. But we're trying to be better as human beings and apply our minds and apply the knowledge he's given us, inshallah. So tie your camel, please. Come and see us. Let us do a scan, because yearly scans are the only way that you can see the ovaries beginning to talk, because it's supposed to be hiding and sleeping once it's in menopause, but it's growing and there's a cyst and something's wrong, and that's how we diagnose cancer of the ovary. Other female cancer. Okay. All right, Bismillah. I think I've done.
I love it. Such awareness that's so important for us women to know our bodies, not to be afraid of it, so that we can obviously take our precautions, as you say, tie camels, get those checkups done. Prevention is always better than cure. Find something, nip it in the bud. Many people try and say, you know what, if I don't get it checked out, then it'll be better. But ignorance is bliss, I believe, because you never know where it can lead you to. Dr. Razina, it's always wonderful chatting with you. Inshallah, we will have you back on Earth Women on our Malcolm and Little One segment, where you all be imparted wonderful information. Allah Azza wa Jal bless you and reward you and guide you always with the patients that you treat. Until we connect again, have yourself a lovely day. Assalamu alaikum wa rahmatullahi wa barakatuh.
Ameen ya Rabbi, to your beautiful duas, and the same and more to you. Take care. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi wa barakatuh. That was Dr. Razina Patel joining us all the way from Santon, and yes, chatting with us about very important topic that affects all women, and that is gynecological issues. Also explaining to us about the various types of cancers and what we need to do. And remember, prevention is better than cure for sure. So be aware of your body. And of course, if there's anything that is not supposed to be in your body, do get it checked out. Time for a break. This is the Urban Woman Show with me, Razia Rangrage. Urban Woman, sponsored by Vada Gold Gem Jewelers.